So thank you. Thank you for making it to the afternoon session. We're going to do some quick introductions. You've got Maruša Jonas, myself, Ann Fischer, who you met earlier, and then Dr. Georgia Jones, who just stepped out for a bit to check on some of our virtual attendees. So she will be back in. But we're here today to facilitate this afternoon discussion around fiber and your perceptions and the communities that we work with and how we should move forward with some of this. But we have a small enough group that we want to do introductions. So we're going to share your name and your organization that you're with, and then what motivates you to join this conversation and the work on grain and dietary fiber. So brief introductions from everyone. So you already heard mine earlier. So Maruša, I'm going to hand this off to you.
Hello, everyone. I'm Maruša Jonas. I'm with Nebraska Extension, working with wonderful Ann. I'm an extension educator, specifically working with limited resource audience across Nebraska. And what motivates me to be here? I just really love to help people. I know a lot of individuals that were impacted by chronic disease, and if we can do something now, that would be wonderful. And I am excited to be here and brainstorm all these wonderful ideas with you. Actually, I'll pass it on to Georgia just because she's one of our facilitators. She's back in the room, but then we'll pass it around the table.
Hello, everyone. I'm Georgia Jones. I'm a faculty member in nutrition and health sciences. I'm also extension food specialist. As to why I got into this business, is that was
Why you're here with the fiber conversation?
Okay. Well, I grew up with a grandmother who had one statement about fiber, and I'm sure you guys all know what that one was. She didn't know about the others, but we had to eat plenty of it every day. So that's my introduction.
All right, we'll go ahead. We're just gonna have everyone.
Catherine Frells, wheat breeder. Yeah, I'm a plant breeder because, like most plant breeders, I wanted to feed people, but I'm a wheat breeder because we really truly do feed people.
I'm Laura Shabloski. I'm the executive director of the Nebraska Cancer Coalition. Why am I here? I'm a cancer caregiver ×3. Both my parents and one of my 4 children are either survivors or currently battling. And nutrition and exercise could do so much in the oncology space. It's the #1 killer of Nebraskans, and doggone it, I'd like to see it cured in my lifetime.
Excuse me. I'm Alan Thorson. I'm a colorectal surgeon, retired from Omaha, but I'm chair of the board of directors for the Nebraska Cancer Coalition. I am here because I've seen lots of colon cancer, as you might imagine, a lot of inflammatory bowel disease during my practice years. I still got lots of questions about it and the impact of fiber in our diets. And I do get these questions from my questions earlier about lectins and things, and trying to figure out the balance between what lectins can have on our GI tract and the impact on the microbiome and the beneficial benefits of fiber, and how to pull that together to bring it a message that people can understand and the patients can understand. So,
good afternoon. My name is Tim Tesmer. I'm the Chief Medical Officer for the Nebraska Department of Health and Human Services. When I first contacted Mr. Wallace some time ago, the light bulb in my head went off, being a physician, that the concept of this being a way of describing food as medicine, looking at the GI tract, the cardiovascular system, the endocrine, the diabetes systems, how this can improve that, and how we at DHHS may be able to participate in some way with some of our programs and our chronic disease prevention unit to help Nebraskans. So thank you.
Hello, everybody. I'm Brett Carver, a wheat breeder like Catherine Frells. I'm at Oklahoma State University. And I've been working on fiber-related breeding objectives since 2012, I think is about when it started. Worked first and still do on modified starch, I really think that's a solution, but I think it has a little bit more problems associated with it than the traits we're talking about today. So this is what motivates me. It's all about health and having wheat be part of our healthy solution.
Thank you. I'm Charlie Stoltenow, Dean and Director of Nebraska Extension. Just a little background. I'm a veterinarian by training, and we don't see a lot of colorectal issues in animals. And part of that could be to their diet. But what I wanted to get back to, I was stationed here 30 years ago as an EIS officer in the Nebraska Department of Health, worked with Tom Safranek. And now I have the wonderful opportunity to come back and lead these great extension specialists and educators out there. The other part of that is we're looking at how do we augment and work with UNMC, and with that rural health mandate, how do we get across the state? How do we bring this to people who really are living in food deserts, or they're living in areas that don't have physicians, let alone the specialties? And so I just really want to say thanks. And then also, is Steve in here? He really twists an arm. He came to see me 2 years ago about this. He is one of those guys who you can't say no to at all.
Hi everyone, my name is Izuchukwu Iwamadi. I'm a PhD student studying food science at the University of Nebraska-Lincoln. I'm excited to be here because I believe food is one way we can use to improve health. Yeah.
Hello, my name is Lucas Townsend. I'm also a PhD student at the University of Nebraska-Lincoln in the food science department. Also a member of the Nebraska Food for Health Center. I'm here because my research focuses on leveraging the human gut microbiota using food to decrease symptoms and diseases such as inflammatory bowel disease.
Hi, I'm Conrad Leifert. I'm a professor at Texas Tech and economist, applied agricultural economist, and do some stuff on public health, a lot of stuff on public health at times. And, I got in the area because I just think fundamentally how Americans eat food, consume food, and also medical products for that matter too, is just really unhealthy. And it's really killing a lot of people. If you want to get down to it, it just affects our lives, what we do on an ongoing basis. And I've seen that personally for people I know that I've missed today. My parents, for example, they didn't take good care of themselves, and they're not here. And, it just makes you feel like, well, we could do a better job of that in terms of public health, in terms of the food we provide. And I think this innovation is something that could really, kind of move the needle, the paradigm, the thinking process as much as anything else, as well as the innovation itself. Anyway.
Thank you. Mitch Rippey, Director of Nutrition and Education with Nebraska Beef Council. And I guess dating back to the opportunities that I had with Jean Ann's team back in college, I've always had an interest in community nutrition. So whether it is beef, grains, wheat, I think it's important to be able to have beneficial conversations with the general population in terms of their overall health, disease prevention, and risk factor mitigation.
Hi, I'm Emma Ninneman. I'm a faculty member for the culinary and baking and pastry programs at SCC. So I teach a lot of bread baking, a lot about flour, and then we also have a new class about the food system and where our food comes from. So I'm excited to be here and talk about flour and kind of how that'll affect this new types of flour might affect bread baking in general, and then also kind of gaining some knowledge for that lovely new course about where our food comes from and why that's so important.
Hi everyone, my name is Wensheng Ding. I'm from the UNL Food Science Department. I'm also a member of Nebraska Food for Health Center. And I'm here because my projects mainly focus on the wheat albinoxylin and the gut health. Yeah.
Very good. My name is Brenda Oftenkamp, and I'm an extension educator located in North Platte. And I'm here because a wheat farm put me through college, is what I would tell you, in Western Nebraska. And I'm real passionate about our family farm still. That's a diversified, dryland wheat irrigated crop farm. But the other part of my job is for the last 30 plus years, I've been a member of Nebraska Extension in several different roles. And I am a family consumer science teacher by trade. I love to teach kids. And I think the root of all of this goes down to culinary and getting kids engrossed in whole wheat bread baking. And I've done whole gymnasiums with kids and made bread in the bag and all of that. And I still do a lot of that today. And now I'm working more and more with adults. But I think there again, it was said earlier, I think Jean Ann said it, what we learned at age 9, 10, and 11 and the foods that we were introduced to drive the rest of whatever we do at the table. And so I'm real passionate about changing adult perceptions, but getting to youth and engaging them in true fiber and fiber bread making or cookie baking or whatever it is to get them to understand the components that make up healthy diets.
Good afternoon, everyone. Zainab Rida, Equity Officer and Administrator for the Office of Coordinated Student Support Services at Nebraska Department of Education. It is a very long title. Sorry about that. But just to give you an idea, like in our office, we address the non-academic needs for the students, that including nutrition services. So we, under KD, and she's going to introduce herself later, just in a minute. So we have the school lunch program that basically we have the whole grain and fiber. It's really part of the meal pattern. And this is going to help us to let them know why it is important, because, you know, when it comes to the whole grain, it's an issue. And when we talk about the food waste, also under our office, we have the child care program. And also we provide a meal pattern and the whole grain. It's part of the meal pattern as well. Another thing that under our office, we have the family and community engagement program. And guess what is number one topic when we talk to the families and when we have activities? It's all about food, right? So it is also, it's a good opportunity to teach them about, you know, the important and how to reduce the chronic diseases in that regard. Another thing that we have farm to school. It's a big component of our program, and we introduce, just like this morning when we talk about all the great thing that's grown in Nebraska, and we teach our kids how it's important to include in that. One of the area that our department is focused on literacy. And I feel like food literacy should be part of that component and talk about all these component of you know, why fiber is important, what is fiber, and introducing all that. So with that, I'm turn it over to Katie.
Hi, I'm Katie Parch. I work with Zainab at the Department of Education, as she mentioned, in the Office of Coordinated Student Support Services. Long name. Really, the goal of our office is to support students and families, like Zainab said, in the non-academic components that support their academic performance in school. And as the director of the child nutrition programs, which includes school breakfast and school lunch, I take my job of communicating the why or the reasons behind what is required for schools to serve to why we have specific requirements for the meals we serve to kids, right? I view it as a public health program that in Nebraska touches hundreds of thousands of students every day. Nationwide, it's millions of kids. So we know it's not perfect, right? We know there's improvements that need to be made, but still it has this opportunity to provide up to 2/3 of the nutrition a kid needs every day. So it's a huge and very important thing that helps support student learning. And I get the opportunity to communicate regularly with school food service directors who are responsible for carrying out program rules and regulations that they never set and don't often get a say in. So I really try hard to motivate them, to get them to buy into this program, because I think it's integral to a school's success if kids eat meals at school, enjoy that academic break during the day, right? Oftentimes, a school food service director is a person who smiles at a kid during the day and asks them how they're doing. I think teachers do that too, but just to know someone or a group of someone cares about you during the school day can be really important for some kids. So I try to leverage the why and explaining this isn't for just to make you have busy work to do and make your life harder. There's a bigger, very meaningful purpose to the program. So I use these kinds of opportunities to learn more so I can be more informed and share that information with folks who carry out the program that we try to support and deliver.
Yeah, thank you. Hi, everyone. I'm Kristen Huska. I'm with the University of Nebraska Foundation, and I get the opportunity to work with our Institute of Ag and Natural Resources development team. So my colleague, Doug Carr, we're kind of tag teaming today. He's in the other room with the producers. We also have colleagues that work on behalf of UNMC, and so I'm in here to gather information and take it back to them. As you all know, funding is a priority in different initiatives, and philanthropy can definitely move things forward. So that's why we're here.
I'm Devin Rose, faculty member in food science at UNL, and we study grain fiber and the gut microbiome and how that influences human health. So this initiative is very in line with what we do, and we're doing some of the first nutrition studies with the high fiber wheats that we already have.
I'm Edward Dean. I'm an assistant professor in food science and technology department. So what motivates me is I understand the value of dietary fiber. So my background and training is in dietetics. I'm a registered dietitian, and my research really focuses on dietary fiber and how it can affect health, partially through its effect on the microbiome, but partially through independent effects.
I'm Cindy Bryson. I'm an extension educator in Omaha. I'm also NRD. Why am I here? Because lately I have really gotten into food as medicine, any sort of information I can get. And yeah, I think it's super important. We get consumer phone calls every day, and we're on the front line of trying to help consumers. So you guys are feeding us the wonderful information and research, and we're able to take it to the consumer. So we appreciate your work. Thank you.
Hi, I'm Lisa Franson Castle, and I'm with the University of Nebraska-Lincoln. I'm a professor and extension specialist in nutrition and health sciences. Much of my research and extension work is focused on food access, availability, nutrition security, so very interested in this type of work. I'm also here as a representative of the College of Education Human Sciences, currently in an interim associate dean role, and so always looking for opportunities for our folks to get involved with important transdisciplinary research approaches such as these. Thanks.
Do we have any virtual attendees to introduce?
Yes, we have two more people, Laura and Steve. Go ahead.
I'm Laura Bielek, and I am an exercise researcher. I work with Corey Hansen and Mariah Jackson, who I know are part of this. Big believer that lifestyle, not just exercise, helps improve, prevent and manage chronic disease. And so I am here to learn more about ways we can improve nutrition and see if there's other opportunities for faculty in the College of Allied Health at UNMC where I work. Thank you very much.
Good afternoon, everyone. I'm Steve Greenspan. My background's a little different than most of the people in the room. My background is in cognitive psychology and decision-making. I worked in the IT industry for many years, but I'm also a co-founder of the Foundation for Innovation in Healthy Food. Many years ago, several years ago, Rod and I had a conversation.
We can read those off and go ahead. For those of you on Zoom, there's some technical difficulty with that, just cutting in and out. So we're going to potentially introduce you here in a bit as we do that. So. All right. My eyes here. Steve Greenspan from Foundation for Innovation for Healthy Food. Thank you for joining. And that's who we've got on. Okay, so thank you, Steve. So this next part here, just a little bit more of an outline of our agenda. So what we want to accomplish today, we talked a little bit about this earlier in the other room. is understanding our own grain fiber intake and what that means, as well as community education. So out of those communities that we're working with, what might be potential gaps in education when we look at current community nutrition education and how that's set up around grain fiber. What does that look like, and how should we prioritize filling those gaps? Knowing some of the research that we learned today and thinking about that in the future as far as different consumer messaging. So really at the end of the day here, we're going to have a few questions that we've got QR codes populated within the slides here that we'll be having you answer. What do you see as the two biggest gaps in health messaging as it relates to grain fiber? And a little bit more about perceptions and how to prioritize that, as well as different approaches to reach certain underserved audiences that we have right now. I think it was Rod who mentioned, there's different levels of people's ability to make consumer food decisions and what that purchasing power looks like. And so how do we alter some of those approaches when we go to survey or find out some additional information? So those will be populated. And the reason we wanted you all to introduce too is because we want you to be able to feel comfortable and safe discussing, bringing up comments, having some discussions around this as we collect more information. So we covered this a little bit earlier, and I'm gonna, for the sake of time, go through this one quick. We kind of cut this. So just a reminder of the costs and the different disease states that we're thinking about in terms of fiber and the risk reduction that we have. And the next few slides then, my role here is to just give everybody a baseline context. So a lot of this is basic information. It's the USDA dietary guidelines, things that all Americans should be aware of and know. And so we're just looking at currently, the fact that what the USDA recommendation is. So on the graph there, you've got the male diet of 31 to 50 grams a day and female diet 31 to 50. And so we're looking at, does increased fiber intake reduce chronic disease risk? Dietary fiber is one of 4 underconsumed nutrients. When you look through the U.S. dietary guidelines, they purposely identify calcium, potassium, vitamin D, and dietary fiber as the priority nutrients there, which are underconsumed. So daily recommended amounts of grains are at least 3 ounces of whole grains per day and less than 3 ounces of refined grains. So the conversation about whether or not we can actually change the fiber intake, fiber amount in those grains is first up for discussion here this afternoon around what some of your thoughts are regarding that messaging, regarding how the U.S. dietary guidelines look in terms of what that would get messaged out. And then on this slide, I'm going to have to come closer here. So focus on meeting the food group needs as we think about that and the core elements. So we're talking about vegetables, fruits, grains, dairy, protein foods, and oils. But today we're focused on the grains. So, and the current message is at least half of your grains should be whole grains. And again, what does that look like going forward as we look at different amounts? And this photo just gives you some visual ideas of what 1 ounce actually looks like when we consume it in food. So when we take dietary intakes from individuals, we're not asking them about how much fiber they ate. We're asking them to describe the food that they ate. So individuals will tell you, whether they ate a sandwich, and then you need to identify like, how big was that slice of bread? Or was it a bun, and was it a 12-inch hoagie, or was it a 4-inch hamburger, those types of things. So lots of variance when it comes to what that actually looks like on a plate versus what that means when we talk about what is a serving. So 1 ounce equivalent of grain, different pictures there. And I'm going to turn it over to Maruša.
Thank you, Jean Ann. So this next, oh, yep, thank you. This next slide is a QR code that I would love for you to scan if you can, or if you're using a laptop, you can type in that link, especially for those on Zoom. That might be easier since you're already at the computer. And here what we're trying to do is look into your own daily intake of grain and what that might look like, and kind of think about what are the foods that provide the grains that you consume daily. And then if you can estimate based on the previous slide, how many ounces of grains do you typically eat each day? And as you're filling that out, you'll see some options like white rice versus brown rice, whole wheat bread versus white bread. Also think about why you make those choices. I'll give a couple minutes here. I do have the survey results pulled up that I can share, probably not on the screen, but I'll definitely read them to you. All right, wonderful. Thank you so much for participating. Our results are showing that 16, actually 17 people in this room out of 20 are eating whole grain breads. 7 white bread. Then also popular choices are white crackers over whole wheat crackers. White rice and brown rice are pretty close, which is wonderful to see. The same as oatmeal. Looks like oatmeal is a popular choice here. And then white pasta is definitely taking the lead over whole wheat pasta. Popcorn seems to be a popular snack in this group. And then we also enjoy cakes and muffins. So when we look at how many ounces of grain we're taking, if we're looking at our average in this room, 36% of participants get about 3 to 4 ounces a day. 18%, 1 to 2 ounces. Only 40% are getting close to that recommended amount of 5 to 6 ounces. And then 18%, which is only 1% in this case, that does get 6 ounces or more of grain. And for this next part of the conversation, yes. There is no reason. Sorry about that. We were trying to be considerate of everyone's time and not listing all the options that exist. Basically, the picture that we were trying to paint here is what is your consumption of grains, and have you thinking why is that? So would someone like to share why you choose white rice versus brown rice, or whole wheat bread in this case over white wheat bread? Anyone?
So I have children. And in my house, I would have whole grain, I would have brown rice, and we have whole wheat bread. But because I have children, we also have white bread and white rice too, because that's not their thing.
Thank you, Cindy.
So brown rice in general, it's very take time to cook, and also when it comes to the texture and flavor, it's very hard to sell it to the kids. So that's why it's white rice all the time. Sorry.
I don't buy white bread at home. I have an 11-year-old, and for her birthday, she asked for a loaf of white bread. Maybe I should buy it.
That's how it was in my household too. I was going to say, I would say you buy what you've always, what you saw your mom put in the cart, and I'm busy rushing into the grocery store. You throw in the cart what you've always had. So it ends up being some of those lower fiber foods.
Wonderful. Thank you, Brenda. This actually brings us to the next point. What we learn from our parents in schools, it all kind of brings us back to education. And I was going to say, oh, next slide, but I'm the one who's supposed to do that.